Hi, I am Dr.O Siva Prasad, consultant pediatrician and neonatologist working at Cloudnine, Thanisandra, Bangalore. Autism and autism spectrum disorders are more or less the same. The only difference is the word if you specify the word as spectrum. So, autism spectrum disorder is a spectrum of disorders which can be as mild autism problem or it can be very severe. So, that wide range of symptoms and signs which a child can show comes under autism spectrum disorder, but more or less widely both of them are used in a similar terms. So when a child is suspected with autism, so there are certain indications where you can suspect autism in a child. So first and foremost, like autism is mainly a neurodevelopmental behavior, so mainly restricted to 2 or 3 domains of development. So social and communication are the first thing which an autistic child might lack, and second thing is restrictive repeated behavior and intellectual disabilities. These are the things where mainly an autism child can show at an early presentation. And autism spectrum disorders is always has to be diagnosed early, and early intervention is better for the development of the child and a better outcome, and has to be evaluated by a pediatrician or a developmental pediatrician to make sure what spectrum the baby is falling into, to guide the child for appropriate treatment. So many of the children who are detected early, especially like before the age of 1.5 years or 2 years, so when you give a holistic approach of treatment, means it's not only about therapy or speech or which behavioral therapy which has to be targeted at, it has to be a holistic approach, means right from the family members of mother, father to the doctor and the therapist, everybody should work as a collective effort to make sure all the problems in the child has to be addressed and has to have a better outcome. And many of the children, when you give a proper holistic approach and a therapy, so most of them will get better in terms of social communication, behavior, language disabilities, or when the problem of hyperactivity or any other problems of the child which has to be addressed for his better social and communication and a better school performance. So many of the children will develop better. So when they have a proper early intervention and when they are addressed properly as a holistic approach. That is why we always say 3 A's of autism, means assess early. So always give proper treatment and avoid harm to the child, means don't isolate the child or don't treat the child separately. Right from home, all the parents and the teachers or the doctors, everybody has to speak to the child, get the child know better, know the deficits in the child, and work towards to better closing up the gaps in the child's communication and intellectual disability. In the initial part, you might need intensive therapy with other speech, along with other domains like visual stimulation, the behavioral therapies, occupational therapies, which all will help in the better outcome of the child to get better. So this early intervention is the key hallmark of autistic children to get better. So this is the first and crux of the treatment of autism. So always treatment starts at home first.